Hi, everybody, and welcome back to our last segment in Mental Health Awareness Month as it relates to Marilyn Monroe, the icon. I'm Nina Bosky, and this is Gary Vitaco Robles. Hi, Gary.
Hi, Nina.
And Gary is a mental health professional, but is also the acclaimed author of Icon, The Lifetimes and Films of Marilyn Monroe. Look at these babies, how big they are, volumes 1 and 2. You are a go-to person as it relates to Marilyn, and I can't think of a better person to be doing this series with than you. And it's been a wonderful journey and quite a deep journey these last several weeks, right?
We've been on this journey for many years together, and I'm really glad we're getting out the message that Marilyn offers so many people in increasing awareness of mental health.
Well, in recapping in this series, what we'd like to do today is recap the different areas of Marilyn's life and the areas that she struggled that you also may be struggling in. But also, we'd like to, with her birthday coming up on June 1st, that we will also share and shed some light around the resiliency and the strength and just the beautiful heart that this woman and human being had, not just a star and an icon, but really a human being that had a beautiful heart inside. So let's recap. Let's go back to the beginning of this month when we went right there at the very beginning and talked about physical and sexual abuse, which Marilyn obviously had. And let's just recap for people that are maybe just tuning in right now. Marilyn had what in her early stages of her life?
Well, we know that there was an intergenerational history of mental illness that went back at least to her great-grandfather who took his own life. She had a grandmother who was diagnosed with manic depressive disorder, which today we call the bipolar spectrum. She had a mother who was institutionalized for many years due to schizophrenia. Probably her uncle had a mental illness as well, and he kind of disappeared from the family's life. So Marilyn had a genetic predisposition to these illnesses, and unfortunately, her early childhood set her up for many adverse childhood experiences. So her mother was unable to care for her, and so in the homes of other individuals, she experienced neglect, poor attachments, physical abuse, sexual abuse over time by multiple offenders, some of them adults, some of them in caregiving roles. And then she was married very early to avoid going back to an orphanage. So she experienced what we call complex trauma, which definitely led to some structural changes and wiring changes in her brain, which set her up for some difficulties later in life. Children can be resilient and bounce back from trauma when they receive developmentally and emotionally what they need from the adults in their lives. However, unfortunately, Marilyn didn't receive that in her experience. So, she didn't have very many protective factors to bolster her resilience, but she had something internal which was very strong and resilient in its own right. And so she entered adulthood, hoping that the film industry would be able to propel her in such a way that she would receive attention and love, which was so absent from her early childhood.
And then we move to what we know of as borderline personality, and we moved into that, which is what we know now that Marilyn most definitely, obviously, she had a lot of fear of rejection and abandonment, given what you just said, right, Gary? What's the recap of that as it relates to Marilyn?
Well, borderline personality disorder is a pervasive challenge in identity and impulse control. It really disrupts the ability to be safe in relationships. There's an extreme fear of rejection and abandonment. There's sometimes self-harming behavior or suicide attempts in order to keep people close, keep people from leaving, and sometimes as a way just to end severe emotional pain, because folks with borderline personality disorders have real challenges in regulating their emotions and navigating relationships. So they tend to have very unstable relationships, tumultuous relationships. And so, clearly later on in life, this was exacerbated in Marilyn's case and is well documented by the last psychiatrist who treated her, Dr. Ralph Greenson.
And if anybody is dealing with borderline personality, and we're going to get into bipolar in just a moment, this is Mental Health Awareness Month. Dr. Phil's certainly a big proponent of this on the national stage. You've got Oprah right now and Prince Harry teaming together for a documentary. You've got celebrities much more willing to talk about it, which back in the day, Marilyn was the only one talking about it. So what would you say to somebody that is dealing with a possible borderline personality, either a loved one or themselves?
Well, don't panic and reach out for some support, because it does require a mental health professional to help establish the diagnosis and to prescribe the interventions or to make referrals to the appropriate treatment providers. And so there's many forms of effective treatments in the modern age so that people can live the full capacity and potential of their lives. So it should not prevent anyone from living a full life. But it's important to link to a professional. It's important to develop a relationship with a professional that you feel comfortable with. And that might take some trial and error, but don't give up.
The other thing that we talked about is bipolar. And if you could distinguish for people the difference between borderline and bipolar disorder. I know I've asked you several times during this series, but it gets very confusing for people because, it's not just one or the other. You may actually have both.
Bipolar disorder is characterized usually by at least an episode of major depression, which would involve hopelessness and sadness and inability to enjoy life, appetite and sleep disturbances, guilt, negative thoughts, thoughts of death and suicide, and also episodes of mania or hypomania. And mania is an expansive, elevated mood, which might also manifest as irritability, a lot of risk-taking behavior, burst of energy, decreased need for sleep, goal-directed activities, involvement in risky behaviors that could lead to negative consequences. And sometimes it doesn't reach that level of a mania. Sometimes it reaches the level of a hypomania, which is less severe, might not be as easily identified and missed. And so, the diagnosis also needs to be made by a mental health professional. And there's many medications and evidence-based treatments for bipolar disorder where folks can live again full, happy life capacity.
So with borderline or bipolar, the key here, and you heard Gary say it, is to reach out for help and to also know that we are living in a day where there's so many resources, guys. You can get out there, you can search the web, you can ask people. And I love what you said last week as it relates to bipolar is let's not look at it and let's be very mindful about what we call people. That, oh, this person's being bipolar, because you wouldn't say that. And I loved what you said. You wouldn't say that, oh, this person's just being cancer. You wouldn't put that kind of label on a person. So let's be more mindful, because I think the more mindful we are and the more compassionate we are and the more open we are to being able to realize that there's a lot of people walking around that are either depressed or have some kind of mental illness disorder in the United States, in the world, really, right? So we have, sexual and physical abuse. There's trauma that can be overcome. You've got borderline personality, bipolar disorder, extreme anxiety. And yet, this woman went out to the world and achieved so much that people without this trauma, without these disorders, can't even achieve. I mean, this is pretty remarkable coming from a woman that probably for all of us is it would be a hard thing to achieve, Gary. So what do you say to that?
Well, this is what's so inspirational about Marilyn, in that she does embody the American dream, because she is an example to us that no matter what adverse conditions we've survived, if we just work hard, we can achieve greatness. And this is what she did at a time in history when there was so little treatment interventions that were effective for her. She really was the first public figure to disclose sexual abuse, which was so brave in her day. She allowed herself to be vulnerable, and in just putting it out there, I think she educated the world about something that was taboo, that really wasn't discussed. And so Marilyn was able to establish her own motion picture company. She made herself famous across the globe. She's transcended death. She continues to inspire people today as a historic figure. She is a Golden Globe award-winning actress, a legend, and kind of our Cinderella story. And just because she has a sad ending, it shouldn't take away from her strength and her resilience and her great accomplishments.
And I think one of the things that people don't realize is the caricature of Marilyn Monroe was a made-up version of that was not her, and so many people thought that that was. And so if you're watching this for the first time and you watch all of her films and you look at her and you think, oh, that's Marilyn, that's just who she was. She was kind of this ditzy blonde. She was extremely intelligent. She was extremely well read and read and she'd probably read your book from start to finish. I mean, because she would be so amazed that, 2 volumes worth, right? We should all be so lucky to have somebody be able be able to write our biography like this, and so many biographies have been made of the star, not only in books but as movies, as well as what we're doing together too on the documentary, as well as the film. So you look at Marilyn and she has so much, and every person that I talk to that is a Marilyn fan, there's usually one of these different buckets. It's her glamour and beauty that people relate to. It's the fact that she's this famous movie star. It's the conspiracy and, oh my gosh, the intrigue of the Hollywood rat pack and the Kennedys and all of that, and all the powerful people she was connected to, the tragedy of that as well. But then I think the one that stands out the most is the fact that she had such a caring heart and a vulnerability that speaks to, I think, the longevity of today. What do you think about that when I share that with you?
Well, it reminds me of all those great stories about Marilyn, that if someone admired a sweater that she was wearing, she'd take it off her back and give it to them, or have one ordered in their size and send it to the house. I think of Marilyn rescuing pets and rehoming them to the children of many of her friends. I think of the children of many of her friends who developed relationships with her and talked so lovingly about her as kind of a child woman who was really able to relate to children in a very special way, because she always kept the child within her at close hand. Despite what she had been through, she never became kind of embittered. She always kind of maintained that wistfulness, that hopefulness. She was a hard worker, who left her fame at the height of her fame to take a huge risk to leave Hollywood to study acting, because her ambition was to become a great dramatic actress and to be a wife and a mother. And so she left Hollywood to study acting at New York. She was ridiculed, thought to be pretentious or ridiculous, but she did that nonetheless. And she came back and performed in Bus Stop and wowed the critics and received a Golden Globe Award nomination. And as a woman in mid-century America, she was very independent. She formulated her own motion picture company. She co-produced films, some uncredited. And she was so adept at self-improvement. You know, she had a 10th grade education. She went to school at UCLA to study literature and the arts. She had a 400 book library that included Tolstoy and Camus and I don't know, many books that I have never even attempted.
So, with her birthday coming up, and there's going to be Maryland fans around the world being able to celebrate her, how would you like to celebrate her this year?
Well, I'd like to celebrate Marilyn as the woman who she really was, who isn't always the woman who's depicted in the media or in some biographies or in some dramatized accounts of her life. I think sometimes that does her a great disservice to kind of think of her in that way that she perpetuates, but to go back to the origin of who she really was, little Norma Jean Baker, and her great rise to fame, the impact that she had on the globe in these last close to 70 years, I would say. She engenders a lot of empathy and compassion. She allowed herself to be vulnerable, which makes, I think, many of us, it's easy to relate to someone who makes themselves vulnerable. And in this day, this era that is not always kind, she tended to live a very kind life.
So, I'd like to say for everybody out there, as a Maryland wish this year, is to be kind. Is to be kind. And so we can kind of hold that thought, not only for Marilyn, but for you, as you may be going through a mental illness issue, you may be going through a trauma, whatever it is. You know, she was able to achieve so much in her short life. And I think what you would want for everybody watching this is that you really do get the right help and that you can transform that in life in a way that she wasn't able to. And so if you want to honor Marilyn's birthday only for yourself or a loved one, is to get the right help and to get the right diagnosis, whatever that may be for you in your life. And Gary Vitaco Robles, I know we're going to read something from Marilyn that she wrote, and it really kind of depicts who she is. You cannot put her in a box. As much as I wanted to during this mental health awareness is put bipolar in a box and borderline and everybody in a box, just like most of us. You can't put her in a box. But I also want to thank you for spending this journey with me over these last several weeks in honoring Marilyn and honoring Mental Health Awareness Month. And hopefully some people can get some help and really transform.
It's been my pleasure, Nina. And so this is Marilyn's poem. And Marilyn had a very insightful way of identifying the challenges in her life, but also her resilience. So in this poem, you'll hear kind of a balance of her struggles and what she sees within herself as strength. Life, I am of both your directions. Life, somehow remaining hanging downward the most, but strong as a cobweb in the wind. I exist more with the cold, glistening frost, but my beaded rays have the colors I've seen in a painting. Ah, life, they have cheated you.
So on that note, we will leave you as we embark on Marilyn's birthday coming up on June 1st. And as always, what are we going to do, Gary?
We're holding a good thought for Marilyn, who would have turned 93 June 1st, and we're holding a good thought for you, our audience.